What are reproductive rights? Reproductive rights refer to the freedom and right of individuals, especially women, to make decisions about their reproductive health and capacity. These rights include the right to decide when and how many children to have, the right to accept or refuse pregnancy, the right to use contraceptive methods, the right to have a safe and legal abortion, and access to comprehensive reproductive health care and information without discrimination or coercion. Reproductive rights are not just health-related, they are fundamentally linked to human rights, gender equality, and women's empowerment. Key aspects of reproductive rights. Access to contraceptives. Individuals should be able to choose and use safe contraceptive methods freely. Right to abortion. Women must have the legal and safe option to terminate unwanted pregnancies. Maternal health services. Pregnant women should receive adequate care during and after pregnancy. Sex education and information. Adolescents and youth must be provided with accurate and age-appropriate sexual and reproductive health education. Infertility treatment. Those unable to conceive should have access to medical treatment and support. Feminist perspective on reproductive rights. Feminists view reproductive rights as fundamental to bodily autonomy and empowerment. Key arguments include: if a woman cannot make decisions about her own body, she is not truly free. Forced pregnancies, involuntary sterilization, or restrictions on abortion violate women's basic human rights. Reproductive freedom is essential for economic, social, and political equality. Status of reproductive rights in India. India has made progress through various laws and policies. Medical Termination of Pregnancy, MTP, Act 1971, allows abortion under specific conditions. Family planning programs. Government promotes use of contraceptives and awareness. Maternal welfare schemes. Schemes like Janani Suraksha Yojana and Pradhan Mantri Matru Vandana Yojana support women during pregnancy. However, several challenges remain. Lack of awareness in rural and backward regions. Cultural pressure, e.g., preference for a male child. Inadequate medical facilities. Cases of forced sterilization in some areas. Restricted access to services for unmarried women and adolescents. Why are reproductive rights important? Heavy checkmark to ensure women have control over their own bodies. Heavy checkmark to prevent unwanted pregnancies. Heavy checkmark to ensure justice and care for victims of sexual violence. Heavy checkmark to reduce maternal mortality. Heavy checkmark to promote gender equality in society. Conclusion. Reproductive rights are not just a health issue, they are about personal freedom, dignity, justice, and equality. Unless women have full control over their reproductive choices, true gender equality cannot be achieved. It is the responsibility of the state, society, and families to respect, protect, and fulfill these rights.